Support comes from Goethe Pop-Up Seattle, presenting 55 Voices for Democracy, a podcast that brings together conversations with intellectuals, artists, and activists. Inspired by Thomas Mann's speeches produced for the BBC during the rise of fascism in Europe. Available on Apple Podcast and Spotify.
Hey, it's Patricia Murphy. It's Wednesday, and this is Seattle Now. Rural counties in Washington have become COVID hotspots. With fewer doctors and limited ICU beds, rural hospitals are struggling to find backup when healthcare workers also get sick. Northwest News Network reporter Anna King is here to tell us about the situation east of the Cascades. But first, let's get you caught up. The first fully at-home rapid COVID test has been given the go-ahead by the Food and Drug Administration. The agency gave emergency backing to Ellume COVID-19 home test. It's a nasal swab sold over the counter. The FDA says you'll be able to buy, swab, and get your results within 20 minutes. Washington Attorney General Bob Ferguson is cracking down on illegal vaping sales. Investigators from the AG's office caught 7 companies breaking Washington's age checks. The investigators posed as minors or used false IDs and tried to buy vaping products online. The minimum age for buying vaping and tobacco products in the state is 21. And the billionaire and novelist Mackenzie Scott has donated $1 billion of her wealth each month for the past 4 months. Scott was married to Amazon boss Jeff Bezos for 25 years. Their divorce left her one of the richest women in the world. Scott signed the Giving Pledge in 2019, promising to give away most of her wealth during her lifetime. Her fortune has skyrocketed by $23.6 billion this year alone. Healthcare facilities around King County are running uncomfortably close to capacity. These are the darkest days so far of the pandemic. In the city, the system seems to be handling the load, but in more rural counties where there are fewer people, there are also fewer healthcare workers, and the situation is much different. Reporter Anna King is here to help us understand. Anna, it's always good to talk to you.
Yeah, thank you for having me.
Anna, you'd think in a small town it might be easier to socially distance and control an outbreak because everybody knows each other. Is that actually the case, though?
You know, I'm just going to give you a very personal example. My mother is terrorized by the post office in the small town that my mother lives at. She has to drive 15 to 25 minutes to get to town, to get to the little post office. When she gets in the post office, there's like 4 or 5 or 6 people in there, many without masks, trying to get their post. And the post officers wear their little masks below their nose or not at all. And so this is the kind of thing that you deal with in a small town. There is no other post office to go to. She can't redirect her mail somewhere else. There is no other grocery store to go to. She has to go to that one grocery store. So I think that a lot of times small towns, everybody is congregating in these 1 or 2 locations, and there's just not places to get away from people.
So the pool is much smaller. So potentially if someone becomes infected, like we're looking at in the town of Tonasket, it can become a really untenable situation. You've been reporting on Tonasket, north of Omak. What's happening there?
You know, I'm struck by how similar this tale is to what happened in Seattle early on in COVID in the Kirkland area, where the most vulnerable and the most at-risk people are the hardest hit. In the town of Tonasket at the North Valley Extended Care, there are now 17 people who have died. Dozens have been sickened, including like nearly half the staff. And this is all since the Thanksgiving holiday. It's just been a terrific event, just terrifying.
And it's important to note that this is a town of 1,000 people. This is a very, very small town.
It is a very, very small town, and everybody has multiple connections. You know, you might work a part-time job here and then work another part-time job, handing out lattes at a coffee stand. There's just multiple connections with each person in their families.
Yeah, and with a deadly virus like this, that interconnectivity can become extremely dangerous extremely quickly. How does what's happening in Tonasket reflect what's happening in other rural counties around the state?
In the town of Winthrop and Twisp in the same county, in Okanagan County, they are actually doing a lot better than some other surrounding communities. And I was talking to some residents the other day that said, yeah, our two towns have just taken a real stand on masks and a real stand on social distancing. And we're figuring out solutions to keep our community as safe as we can. And the tourists that come to our town that have not been doing some of the activities that we are doing, like wearing masks everywhere, we just hand them a mask at every store they enter and say, this is the way we do it here. And it becomes very clear that this is the moray, this is the culture of these two towns, and they really want to stay open for business, and so they're really taking it seriously.
Anna, just because there is an outbreak of COVID or a large number of COVID cases in a town doesn't mean that the people there don't still need the routine care and the specialty care that they were trying to get before. How is the pandemic impacting that kind of care?
I guess I'd tell a personal story, Trish, which is basically I needed specialty care. I needed some care for COVID after I had COVID. I am currently wearing a heart monitor for like 2 weeks now, almost 2 weeks. I had to get, into a cardiologist. My heart's been racing. That's one of the symptoms that you get after COVID, that people have reported. And it's been really scary. And I called the cardiologist. I had a referral. I did all the right things. And they were like, oh yeah, we can see you in like January or February. And I was like, I can't wait till that. This is super scary. This is really scaring me. And so they did get me in sooner. But now I live in the Tri-Cities, which is a larger community. It's it's one of the biggest urban areas east of the mountains. We have a lot more resources. Now, if you lived, let's say, even just in Pendleton, Oregon, or if you live in Umatilla, which is only about 45 minutes from us, you're still dealing with a 45-minute drive for care possibly, or not enough access for care. And so these specialties are really hard to get. Like, you might have a primary doctor, but if you need anything more complex, it might be really, really tough.
Yeah. One of the things I keep thinking about as we're talking, Anna, are those healthcare workers who have been doing this job since the beginning, and the level of burnout they're probably all dealing with right now. How are these challenges impacting the medical staff in rural clinics?
The people I'm talking to are just getting really, really worn down and really tired. When I go to wildfires or when I go to landslides, I encounter people who are utterly exhausted and are just at their wits' end and crying at weird points in conversations because they're so exhausted and they're so traumatized. I'm hearing that same exhaustion in the voices of the medical staff that I'm encountering as I do these interviews. Even over the phone, it's really, really tough to hear their voices crack and their emotions surface because they are professional people, but they're just tested to the limit right now.
It's hard to believe that anyone wouldn't take every precaution possible after listening and watching healthcare workers do their job over the past few months. Anna, back to this idea of how small communities are different. Will the vaccine have a better or faster impact in a small population? Is there an upside in this for a small town?
Everyone you vaccinate will be a real big help because in a small community, there are less nurses, less doctors, less specialists. So each one is precious. And if you are able, not that the urban ones aren't precious too, I'm not saying that, but I'm just saying there's less of them. So if you vaccinate, there's a bigger swath of world that they impact in a rural community.
Anna, in Seattle, UW Medicine and other healthcare facilities began to issue the vaccine this week. What's the status of the vaccine in Eastern Washington where you are?
I talked to somebody this morning that said that the vaccine is coming to Tonasket, and I am really excited for them. You could hear the excitement in their voice. They're really excited to get the vaccine, and they have a super cold freezer in Tonasket that they bought, so they're ready to accept those vaccines, and they think that's one of the reasons they might have been kind of on the top of the list in a rural community to get them.
Anna King, I can't wait to check back in with you to hear about how well the vaccine is working in Eastern Washington. It's always good to talk with you. Thank you so much.
Thank you.
Anna King reports on everything east of the Cascades for the Northwest News Network. Great to talk to you, Anna. Thanks.
Thanks for having me.
Thanks for listening to Seattle Now. The show is produced by Matt Martin, Sophie Reed, Clare McGrane, Caroline Chamberlain Gomez, and Jason Pagano. Matt Jorgensen does our music. I'm Patricia Murphy. See you tomorrow. As this memorable year comes to an end, it's good to know we got through it together. KUOW has been able to bring you programming that broadens your perspective, thanks to our members who step up to support this work. If KUOW has been there for you at some point in the past year, consider making a financial gift to ensure a new year of telling important stories about our community. Use the link in our description to make your gift today. And thanks.